Football, being one of the most popular sports globally, is enjoyed by millions of players of all ages and skill levels. However, like any physical activity, football carries the risk of injuries. This video aims to raise awareness about the most common injuries that football players face and how to prevent them. Our goal is to equip you with the knowledge to stay safe, improve your performance, and ensure a swift recovery if injuries do occur. Let's talk about the 4 most common injuries in football. Muscle strain, also known as a pulled muscle, occurs when the muscle fibers are overstretched or torn. This often happens when the muscle is stretched beyond its limit or subjected to a sudden, forceful contraction. Strains typically occur during activities that involve sudden starts, stops, or changes in direction, such as sprinting or jumping in football. The most commonly injured muscle while playing football is the hamstring. Hamstring strains are common due to the high-speed running and sudden stops involved in football. Other muscles involved are quadriceps. The muscles at the front of the thigh can be strained during kicking activities. Calf muscles. Strains in the gastrocnemius and soleus muscles occur frequently during explosive movements like sprinting and jumping. Sprains of the ligaments. A sprain is an injury to a ligament, the fibrous tissue that connects bones to each other and provides stability to the joints. Sprains occur when a ligament is stretched or torn due to a sudden twist or impact. It is common in football when players pivot or change direction quickly, or when there is a direct blow to a joint. Common areas affected are ankle sprains. Often occurs when the foot rolls inward inversion sprain or outward eversion sprain, damaging the ligaments on either side of the ankle. The ligaments affected are anterior talofibular ligament ATFL, calcanefibular ligament CFL, and deltoid ligament. Knee sprains. It happens frequently due to sudden changes in direction, direct impact, or improper landing from a jump. Common ligaments affected are anterior cruciate ligament and medial collateral ligament. Strengthening exercises. Strengthening the muscles of the core to provide better support and stability. Balance and proprioception training. It enhances the body's ability to sense its position in space, reducing the risk of sprains. Examples: balance exercises on a wobble board, single leg jabber, and agility drills. Hamstring pull is a very common condition in footballers. Nordic curls are the best exercise for the same. It strengthens the muscles by eccentric loading.
The plant and cut maneuver is a fundamental technique in football used to change direction quickly while maintaining speed and balance. It is crucial for evading defenders, making sharp turns, and executing precise movements on the field. Mastery of this technique reduces the risk of injury and enhances overall performance. Use of appropriate footwear with good ankle support, knee braces, or taping provides additional support during high-risk activities. Treatment and rehabilitation. Immediate care is provided by rest, ice, compression, and elevation of the injured leg to reduce pain and swelling in the initial phase. Pain management is done by medicines under medical supervision. Rehabilitation. Physical therapy is essential for restoring strength, flexibility, and stability to the injured limb. A tailored program may include range of motion exercises, strengthening exercises, and proprioception training. Gradual return to activity, slowly reintroducing activities under medical supervision to avoid re-injury. Surgical intervention is required in severe cases of ligament injury. Friends, football-related injuries can be minimized by doing sport-specific preventive exercises as well as injury prevention drills. Dr. Yogesh Sisodia, who is a sports orthopedic surgeon, has designed Poon Sports Injury Prevention Program by keeping above factors in mind. It is a sport-specific and customized program as per the needs of the athlete. The research has proven that sport-specific injury prevention program reduces injuries significantly. Please share and like this video and subscribe to my channel to learn more about sports-related injuries.